Assalamu alaikum. My dear students, I am Dr. Sagia Afrose, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. In my previous class, I have told about the parenteral anti-diabetic drug insulin, and in my today's class, I am going to discuss about the oral anti-diabetic drugs. In my previous class, I have classified the oral anti-diabetic drugs that are insulin secretagogues and insulin sensitizers. Insulin secretagogues are sulfonylurea, meglitinides, incretin analogues and mimetics, and insulin sensitizers are biguanides, thiozolidinediones, and the agent that reduce the glucose absorption, that are alpha glucosidase inhibitors. At first, I am going to tell about the sulfonylurea. How sulfonylurea acts? As it is a insulin secretagogue, it acts by two major mechanisms. One is increased insulin release from the pancreatic beta cell, and another is decreased serum glucagon concentration. How it increases insulin release? The drug binds with the ATP sensitive potassium channel and it inhibits the efflux of potassium and causes the depolarization. Thus, it causes the opening of the calcium channel. Through the calcium channel, there is increased influx of calcium and release of preformed insulin. And the another mechanism is reduced serum glucagon concentration. The long term administration of this drug may reduce the serum glucagon level by enhancing the release of insulin and somatostatin, which inhibit the alpha cell secretion. What are the indications of sulfonylureas? Sulfonylurea can be used in type 2 diabetes mellitus in non-obese person. What are the adverse effects or what are the drug reaction that may occur in case of administration of sulfonylurea use? Hypoglycemia, weight gain, and it cannot be used if 30% of pancreatic beta cell is not active, hypersensitivity reaction, hematologic toxicity, leukopenia, thrombocytopenia, and safety during pregnancy is not established. So, we should avoid this drug during pregnancy, and secreted in breast milk. So, we should not be given to the nursing mother. What are the contraindications of sulfonylurea? There are type 1 diabetes mellitus, gestational diabetes mellitus, lactating mother, hepatic insufficiency and renal insufficiency. Now, I am going to discuss about the biguanides. Biguanide is a insulin sensitizer. How the biguanides or metformin acts? It acts by 5 different mechanisms. Number 1 is reduce hepatic and renal gluconeogenesis. Number 2, decrease glucose absorption from the GIT, and number 3 is increase glucose to lactate conversion by enterocyte. Number 4, increase glycolysis. Number 5, decrease plasma glucagon level. What are the indications of metformin? Metformin can be used in insulin resistance syndrome, type 2 diabetes mellitus, type 2 diabetes mellitus in obese person, polycystic ovarian syndrome, non-alcoholic fatty liver disease, and treatment of obesity. Last 3 indications are non-diabetic indication, and very important indication in this condition. Metformin is a very good option. What are the adverse effects of metformin? The major adverse effects are GIT upset, that means gastrointestinal tract upset. There may be nausea, vomiting, diarrhea, abdominal discomfort, decreased vitamin B12 absorption. It may lead to megaloblastic anemia and lactic acidosis. What are the contraindications of metformin? Number 1 is renal disease, alcoholism, hepatic disease, condition predisposing to tissue anoxia like chronic cardiopulmonary dysfunction. Now, the third drug, Thiozolidinediones, it is another insulin sensitizer. How the drug acts? It decreases the insulin resistance, it stimulates the nuclear hormone receptor, peroxisome proliferator activated receptor gamma, which is located in the skeletal muscle, adipose tissue and liver. It causes differentiation of the adipose tissue and stimulate the peripheral insulin sensitivity, and thus it is called the insulin sensitizer. It promotes the peripheral uptake of glucose in the skeletal muscle and increase the utilization of peripheral glucose. What are the indications of thiozolidinediones? Type 2 diabetes mellitus in insulin resistance case. What are the adverse effects? The adverse effects are weight gain, fluid retention, decreased bone density, extremity bone fracture in case of women, heart failure, hepatotoxicity and dyslipidemia. What are the contraindications? Contraindications are obesity, pre-existing edema, liver disease and heart failure. Now, I am going to discuss about the drug alpha glucosidase inhibitor. What are the name of drug? Acarbose and miglitol. How this group of drug acts? They act by reversibly inhibiting the alpha glucosidase enzyme. It is the final enzyme for digestion of the carbohydrate and decrease the digestion and absorption of the polysaccharide and sucrose. GLP-1 release is promoted and postprandial glucose level reduced without significant increase in the insulin level, and regular use decrease the hemoglobin A1C. What are the adverse effects? Adverse effects are flatulence, abdominal discomfort, loose stool due to fermentation of the unabsorbed carbohydrate. Now, I am going to discuss about some newer anti-diabetic drug called GLP-1 receptor agonist. The location of the receptors alpha cell, beta cell, central and peripheral neuron and gastrointestinal mucosa. How this drug acts, or what is the mechanism of action of GLP-1 receptor agonist? GLP-1 is an important incretin released from the gut in response to the ingested glucose, and it induces the insulin release from the pancreatic beta cell only at high oral glucose concentration, inhibit the glucagon level from the alpha cell and slows the gastric emptying and suppress the appetite. GLP-1 is rapidly degraded by the enzyme DPP-4, that is dipeptidyl peptidase 4. Now, the another group of drug DPP-4 inhibitor or dipeptidyl peptidase 4 inhibitors. How this group of drug acts? They competitively and selectively inhibit the dipeptidyl peptidase 4 enzyme and selectively inhibit the enzyme with no degradation of the GLP-1. In my previous slide, I have said that GLP-1 is an incretin that is released from the gut and indirectly potentiated the action of the GLP-1 and boost the postprandial insulin release and decrease the glucagon secretion, slowing the gastric emptying and suppress the appetite. What are the adverse effects of DPP-4 inhibitors? The important adverse effects are nausea, loose stool, headache, rash, allergic reaction, edema, nasopharyngitis, cough and pancreatitis, etc. What is the indication? The indication is type 2 diabetes mellitus. That is all about the oral anti-diabetic drug. Thank you all of my students. In my next class, I am going to discuss about any other next topic.